Okay, gathering my equipment. I have my stethoscope, my pen light, my tendon reflex hammer, tongue depressor, and otoscope. All right, let's go. Okay. Knock, knock, knock. Hi, my name is Nathan. I'll be a nurse today. How are you doing?
Good.
Good. Okay, first things first. May I see your wristband, please? And can you confirm your name and date of birth?
Aaron Ramos, August 13th, 1999.
All right, perfect. So today I'm going to be doing a full assessment on you, starting from your head and all the way down to your toe. Is that okay?
Mm-hmm.
All right, I'll raise the bed. Okay, now looking at the head is normal cephalic and is oval in shape and is symmetric bilaterally. Is it okay if I touch you?
Mm-hmm.
Okay, do you feel any pain or tenderness as I palpate here?
No.
Okay, patient does not feel any pain or tenderness upon palpation. I do not feel any masses or lesions. And while I'm here, I can see that the hair is black and fine. It is full and the hair is evenly distributed. I do not see any signs of pediculi. Okay, now looking at the face, I see that the face is round in shape. I don't see any involuntary movements and is symmetric bilaterally. I'm going to go ahead and assess your facial movements now, okay? Can you go ahead and raise your eyebrows? Can you wrinkle your forehead? Okay, can you smile? Can you smile with teeth? Can you frown? Can you puff out your cheeks? Can you pucker your lips? And can you whistle? Okay. Patient is able to perform all facial movements smoothly and symmetrically. We're now looking at the external eye structure. I see that the eyebrows are black and evenly distributed. I don't see any cuts or lesions. Looking at the eyelids, I see it is symmetric bilaterally. I don't see any swelling, lesions, or any ptosis. Looking at the eyelashes, I see that the eyelashes are black in color. It is evenly distributed, and the upper eyelashes curl up and the lower eyelashes curl down. Okay, so I'm going to go ahead and assess your external eye structure now. Okay, I see that the conjunctiva is pink and moist. The sclera is white with noted vessels, but that is normal. I see that the cornea is transparent and moist. The iris is dark and brown in color and is evenly distributed. Okay, I'm going to go ahead and test for corneal light reflex. Okay, I see that the corneal light reflex is present in both corneas, which tells me that the eyes are aligned. I'm going to test your extraocular movements now, okay? Go ahead and follow this with your eyes and do not move your head. Okay, patient is able to perform all extraocular movements smoothly and without no nystagmus. I'm going to go ahead and test your pupillary response. Okay, I see that the pupils constrict briskly as I shine the light. Okay. Okay, as I shine the light on one eye, the other eye constricts as well as the other. Okay, go ahead and look at in the distance. Now look at this. Okay, I see that the patient's eyes constrict and converge on close objects and dilate on farther objects. Alright, now I'm going to go ahead and palpate your ear. Do you feel any pain or tenderness as I palpate here?
No.
What about here?
No.
You?
No.
Patient does not feel any pain or tenderness upon palpation of the tragus, the auricle, and the mandible. Okay, I'm going to go ahead and look into your ear. I'll go ahead and pull up and back. Okay, I see that the external ear canal is pink and moist, and there is noted discharge of cerumen, but that is normal. I do not see any cuts or lesions. Looking at the tympanic membrane, the tympanic membrane is pearly gray-white, and the cone of light is at 7 o'clock, and it is concave in curvature. Alright, and I'm going to go ahead and do the whisper test on you. Go ahead and repeat back what I say.
99.
Okay, patient is able to repeat back what I said. Does not exhibit any hearing loss. Okay, now looking into the nose, I see that the nose is midline in the face. There's no abnormal discharge or displacement. Now looking to your nose, the nerves are symmetric bilaterally. I see that there's no deviate septums or foreign bodies or any cuts or lesions and are clear of obstructions. Okay. Go ahead and palpate your sinuses. Do you feel any pain or tenderness here?
No.
Okay, patient does not feel any pain or tenderness upon palpation of the sinuses. Now looking at the lips are pink and moist, and there are no cuts or lesions. Can you go ahead and open your mouth? Okay, I see that the tonsils are not enlarged, so grade that as a 1 plus 1. And can you go ahead and say ah?
Ah.
Okay, I see that the patient's uvula retracts when the patient says ah, and the oral mucosa is pink and moist without any lesions or cuts. Okay, I'm gonna go ahead and test your range of motion of your neck now, okay? Can you go ahead and tuck your chin? Hyperextend your neck. Bring your ear towards your right shoulder, right ear, and your left ear towards your left shoulder. Can you rotate to your right? Rotate to your left. Okay, patient is able to perform full range of motions of the neck. Okay, now go ahead and turn towards my hand. Okay. And can you shrug? Okay, patient has a strength of 5 out of 5 in both their neck and shoulders. Alright, now can I see your hands please? I see that the nail is pink and smooth. There's no signs of splitting or ridges. You'll go and test your capillary refill. Okay, so the capillary refill is less than 3 seconds. Can you do this for me real quick? I see that the nail bed angle is less than 160, so there's no sign of clubbing. Let me see your hands again. Okay. I see that the patient's skin is hydrated and elastic and there's no signs of tenting. I'll go ahead and assess your radial pulse. Okay, patient has a pulse amplitude of +2 and is regular in rhythm and is equally symmetric bilaterally and has 80 beats per minute. Patient has a respiration of 16 breaths per minute and is regular in rhythm, and there's no signs of using of accessory muscles. Alright, we're going to go ahead and test your range of motion of your upper extremities. You go ahead and flex your elbow. Extend. Alright, can you flex your wrist? Can you extend it? Now holding a box, can you close it with your fingers? Open. Can you rotate your wrist? And down. Can you open your fingers together? Can you move it inward? Outward? Okay, patient is able to perform full range of motion in the elbows, wrists, and fingers. Can you do this for me real quick? I forgot about this one. Okay, you do this. Can you rapidly alternate? And then can you touch your nose into my finger? And then can you supinate? Alright, patient is able to perform motor functions of the fingers. I'm going to go and test your range of motion of your, or strength of your upper extremities.
Mm-hmm.
Can you go ahead and flex as I pull back? Okay. Can you go ahead and extend? Can you do the same thing with your wrist? Can you grab my fingers? Okay, patient exhibits a 5 out of 5 is strength in their elbows, wrists, and fingers. Okay, now I'm gonna go, can you go ahead and take off your shirt? sit on the bed. Okay. Now looking at the posterior thorax, I see that the skin is intact and the color of the skin is brown and uniform throughout the whole body. I do not see any cuts or lesions. You go ahead and listen to your breath sounds, and can you breathe in through your nose and out through your mouth? Okay? Alright, can you lift your arm, please? Can you lift your other arm? Okay. Upon auscultation, I do not hear any adventitious sounds, and the lung sounds are clear throughout. Alright, go ahead and sit at the edge of the bed again. Okay, looking at the anterior thorax, I see that the skin is intact. The skin is also color and is uniform throughout the whole chest. I don't see any cuts or lesions. I'm going to go ahead and listen to your lung sounds in the front again. Okay? Alright, upon auscultation, I do not hear any adventitious sounds, and that the lung sounds are clear throughout. Okay, now I'm going to have you lie down. Go ahead and lie down. Okay, now looking at the pericardium, I see that there are no visible pulsations. Okay, upon palpation, I do not feel any thrills or heaves. Alright, I'm going to have you sit up again so I can listen to your heart sounds. Okay. Alright, upon auscultation, S1 and S2 are present, and I do not hear any extra harsh sounds such as murmurs or brutes. Alright, now I'm going to have you lie back down again. Okay, now looking at the abdomen is flat in contour. I don't see any diluted venous parents or any cuts or lesions. Okay, I'm going to go ahead and listen to your bowel sounds now. Okay, patient has 5 to 30 bowel sounds upon auscultation, and they are normal, active, and high-pitched and gurgling noises. I'm going to go ahead and percuss, okay? Okay, upon percussion, I hear tympanic membranes in all areas except dullness in the region with the liver in the right upper quadrant. Okay, I'm going to go ahead and lightly palpate and let me know if you feel any tenderness or pain, okay? Feel any pain or tenderness?
No.
No. Okay, upon palpation, the patient does not feel any pain or tenderness, and I do not feel any masses. I'm going to have you sit on the side of the bed now. Alright, now looking at the leg, I see that the color is brown and uniform throughout the whole leg. I don't see any abnormal vascularities, cuts, or lesions. I see that the hair is black and evenly distributed. I do not see any superficial veins. Okay, now looking at your toes, I see that the nails are smooth and pink. I don't see any ridges or splitting. Okay, I'm going to test for capillary refill. Okay, capillary refill is less than 3 seconds. We'll go ahead and palpate your posterior tibialis pulse and your dorsalis pedis, okay? Okay, patient has a pulse amplitude of +2 in the posterior tibialis and dorsalis pedis pulse. Is regular in rhythm and equal symmetrically bilaterally. Okay, I'm going to test your tendon reflex now. So the patient exhibits a +2 in patellar tendon reflex on the right knee. Alright, I'm going to go ahead and assess you for your motor function. Can you rapidly tap your feet? Can you run your right heel down your left shin? And do the same for the other. And can you draw a figure 8 with your feet? And do it with the other. Okay, patient is able to perform all tests of the motor function. Alright, now I'm going to have you stand up. Do you feel any lightheadedness? Alright, I'm going to have you bend down now. Let's check your spine. Okay, so I see that the spine is midline. Do you feel any pain or tenderness as I palpate?
No.
Patient does not report any pain or tenderness upon palpation of the spine. I do not see any masses, nodules, or cuts, and there's no evidence of kyphosis, lordosis, or scoliosis. Alright? I'm going to test your range of motion. Since you're already flexed, you don't have to do that. I'm going to have you hyperextend your spine. So lean back. Okay, now lean side to side. Here, rotate to your right. Rotate to your left. Alright, patient is able to perform full range of motion in the spine. Alright, now I'm going to have you do is walk from here to there as if you were normally would. And now turn around and walk back with heel toe. Alright, can you hop on one leg? And can you stand on one leg with your eyes closed? Try again. Okay, you can go ahead and sit back down. Lower the bed. Okay, patient is able to perform normal gait with normal hand swing and is able to balance. Okay, Mr. Olmos, this concludes the full head to toe assessment. Do you have any questions for me? No? Okay, well, here's your call if you need anything, okay? Now I'm going to lower the bed. Alright, you have a good day.
Thank you.